Something that you touched on, and I just wanted to make sure if you wanted to discuss this more, that we had room for this, is you mentioned that when you were becoming a physician or interested in going to medical school, as a woman and as a minority, you realized that you were joining a largely male-dominated profession. And even today in 2021, there is less than 150 female African-American ophthalmologists out there, which is, when you just view that figure on paper, is really quite astonishing. And in the landscape of medicine and the gender gaps and the racial and ethnic disparities has definitely changed since when you were in medical school, but there's still obviously quite a bit of ground to cover still. What advice do you have for young women or minorities who are interested in joining the medical profession or becoming an ophthalmologist?
A few things. First of all is, I think one of the biggest challenges is to do something that you've never seen anybody do that looks like you, and to be open to considering things that you may not have considered, to be open-minded about considering your career. The other is, I think mentorship is so important. It's just fundamental because there are challenges that students run into throughout undergraduate and medical school that are, I think, unique sometimes to being a woman in medicine, unique to being a person of color in medicine. And that's not to say that other people can't understand and can't be supportive. That's not what I'm saying. But sometimes there's a unique understanding that happens when somebody has had a similar experience themselves. And to have that sort of guidance, that sort of mentorship, I think is really, really important. There certainly is a need. It's amazing. It's wonderfully amazing to me how many more women there are in medicine now than when I started. And it's been a relatively short period of time that there's just been tremendous changes. But when you look at leadership in medicine across the board, I'm hopeful that that will happen. There's some metrics that suggest that it's not going to be a slam dunk that will happen. But we certainly are making progress in that direction. And that really gives me heart.
I see the changes even from the time I was a medical student, just looking at ophthalmology leadership, where the AUPO is going, sort of the direction they're taking, what the Academy's focus is, the current president, the past presidents that we've had. I think we're seeing that change incrementally over time.
And I think it comes from intentionality too. I think it's people realizing that this is important and it's right, and putting energy towards doing what's good for the profession. And it's encouraging to see it.